Welcome to the Kol Shalom Lab educational series.
Hi everyone, my name is Michael Romano and welcome to our neuroimaging series. This is part 2 where I'm going to go into further depth with T1, T2, and flare sequences. This is an axial T1 image. So to start, there are many ways that MRI images can be collected. Some of the language that we use to talk about MRIs includes the plane of the image. When we're looking basically from the bottom of the patient to the top, it's called an axial image. That would be what we're looking at right now. This, when we're looking front to back, would be a coronal image. And here, when we're looking at the side of the patient, is a sagittal image. Each of these images have different good things. We look for different things in each of these planes. For example, on the sagittal image, we might pay attention to the pituitary gland a little bit more closely. You can look at, different sinuses throughout the brain. When we look front to back, you might get a good look at hippocampi. Again, this is the coronal plane, and here again is the axial plane. Here, I like it just for a nice overview of everything. So what we're looking at here also is called a T1 sequence. There are several different ways to acquire MRIs. If you took chemistry in college, you probably went over NMR, nuclear magnetic resonance imaging. That's essentially what an MRI is, except that is in 3 dimensions. We're just trying to characterize the local chemical environment around hydrogen atoms here. So a T1 weighted sequence emphasizes something called the T1 relaxation time, which gets into some physics. Not incredibly important. The important thing about T1 imaging is that the gray matter here is a little bit darker than the white matter. The ventricles, which contain cerebrospinal fluid, are dark here. Fat is a little bright. Skull or bone is going to be dark pretty much regardless of the sequence you look at. You can get a pretty good look at some of the muscles in the face. This is a sequence that's primarily useful for looking at anatomy. So, for example, different types of dementia, this would be helpful. If there are parts of the brain that are missing, this could be helpful. If you just want to look at different gyri or sulci, a gyrus is basically one of these tubular thingies, and the dark space between them that kind of interdigitates between them is called a sulcus. You see those kind of throughout the brain. Nice to see here. And any sequences, you can acquire them for reasons that involve physics in either 2 dimensions or 3 dimensions. In 2 dimensions, you pick one of the planes that we discussed, axial, sagittal, coronal, and you acquire slice by slice through that plane static images. 3D acquisition does take a little bit longer, but it acquires each voxel in 3 dimensions at the same time, and that allows you for better reformats. For example, and I went through this in the other video, so excuse me for repeating myself, this is a 3D image, and right here we can reslice it in this dimension. It still looks pretty good, right? You can see most of the gyri and sulci, and that's because each of these voxels is obtained simultaneously in 3 dimensions. However, if we go to a 2D image, I'm going to try not to cheat. This is a different type of sequence, but we can just take a peek at it. So we'll talk about this in a second. If we reformat this kind of looks like garbage. And that's because this was acquired as a 2-dimensional image. So if you're doing any kind of, really, I think any type of 3-dimensional, unless you have a particular reason to use 2-dimensional sequences, I would recommend using a 3-dimensional MRI sequence in any machine learning research. It'll be easier when you're playing around with images, reformatting them, treating them like volumes. Things will just tend to make a little bit more sense in that way. And then we'll go over a little bit of anatomy as well to kind of circle back to that. So this is right here what I'm circling, the medial temporal lobes. This is where your hippocampus sort of lies, right here. You can see it over here, right here. It's a nice look at the hippocampus as well. So really, you can see the hippocampus pretty nicely on either the sagittals or the coronals. I think they're probably the best sequences to look at the hippocampus. Obviously, you see here as well, a little bit more tucked away, but that would be one region that's pretty relevant, obviously, for most types of dementia, seizures, epilepsy. The temporal lobes are basically right here. And when people talk about the temporal lobes, temporal lobe atrophy, that's what they're referring to. In certain variants of Alzheimer's disease, you also see some atrophy of the frontal lobes, the parietal lobes, and further down, the occipital lobes. Every region can be affected in different diseases, but that's just a gross overview of what we're looking at. And again, I mentioned before, but E-anatomy, that's E-anatomy, is a fantastic resource if you're interested in kind of diving deeper into anatomy. So next, we will go over some T2 images. So we don't use T2 imaging for a whole lot, to be honest. So here you can see that there's kind of a reversal in the relationship between the color of the gray matter and the white matter. At the rim, we see gray matter, and that's a little bit brighter than the white matter, which is a little darker here. Also, you see the cerebrospinal fluid in the ventricles. These are the lateral ventricles, going down to the third ventricle, cerebral aqueduct, and lower. These are, bright on T2 sequences. Sometimes this is a really good sequence to look at white matter. Not sometimes. It's always a good sequence to look at white matter. In particular, white matter and changes down in the posterior fossa, which is where the cerebellum is located. This is the cerebellum, okay? But the fact that the cerebrospinal fluid is very bright poses some issues. And we'll see there's a nifty trick that gives us an image called the flare. That's very useful for looking at a lot of diseases that we'll get into next. But first, the other thing that's really useful for this image is to look at the blood vessels. That's kind of just an aside. You see eyes are bright here too. Fluid is generally going to be bright, which leads us to the fluid attenuation inversion recovery sequence, or the flare. If you've done a neurology rotation in medical school, they generally jump right toward this. So a flare sequence is a T2 weighted sequence, which means at its base, you're going to have bright CSF, you're going to have dark white matter and brighter brighter gray matter around the periphery of the brain. And that is going to be very useful. This sequence is going to be useful for us because what we actually do is they use a trick where they zero out the signal from the CSF. So imagine if you go back to your NMR from physics or chemistry, you basically just take the peak where that would represent CSF and you subtract it from the image. And this allows us to get a really good look at the white matter right around the ventricles, which is tough to see when it's obscured by all the brightness that's native to the T2 sequence. So flares are useful. I suppose you could use them for anatomy. We usually don't. We usually look here for white matter changes. For example, these dots right here in the right frontal lobe. So you can see these, white matter changes in a lot of diseases, demyelinating diseases like multiple sclerosis you may have heard of. You can see white matter changes in if there's like a lot of fluid in parts of the brain. You can see them in small vessel disease, as commonly seen alongside Alzheimer's disease. You can see that in chronic migraines. This usually little white matter hyperintensities in the frontal lobe you can see in migraines. And this is just an axial flare. So we do have a sagittal 3D flare, so I can prove to you that hopefully this is actually a 3D flare. Maybe it is, maybe it isn't. This doesn't look too good. But anyway, that's the main utility of the T1, the T2, and the T2 flare.